Okay.
Well, good afternoon and welcome to the September edition of Arizona Community Grand Rounds. We're pleased that you joined us today. In a minute, we'll introduce our presenters as well as review a topic for an upcoming rounds that you see on your screen for November. But first, by way of introduction, these rounds are co-hosted by Blue Cross Blue Shield of Arizona and the NARB Institute. I'm Mark Carroll. I'm privileged to serve as the Chief Medical Officer for the Medicaid plans within Blue Cross Blue Shield of Arizona. Mary Jo Gregory, President and CEO of the NARB Institute, is my collaborator, mentor, and colleague, friend, who also co-hosts these rounds. She's not able to be with us here today, but we're pleased to do this and to do this on a monthly basis. We've been doing this for 2.5 years now, just had a great series of presentations to date. And if you take a peek in the chat, Jennifer Pierce, who makes things happen wonderful behind the scenes of a technical nature and a programmatic nature, thanks Jen, we'll put in a link to where you can get access to not just today's recording, but all the recordings of sessions that we've done since early in 2020. The topic for November is noted here. We have a fascinating panel of experts with different backgrounds on the important topic of raising a child with Down syndrome, an update on research, resources, and service gaps. Just as a note, this will be in November in recognition and observance of Yom Kippur holiday and celebration in October. We will not be having rounds in October. So I'd like to introduce today's presenters. We have a very distinguished panel of colleagues, friends, some of them friends that I've known for many years and new friends that I'm making, which is always one of the great benefits of learning together and working through a pandemic and experience like we've had in the past couple of years. Our topic today is on the important issue of climate change and its relationship to the health of humans in Arizona and of health professionals and all of us. So we're really looking forward to hearing today's presenters. By way of brief bio, and forgive me for just reading from my notes, but Dr. Ed Maibach is a personal friend and colleague of many decades. It's great to see you, Ed, and thanks for taking the opportunity to do the presentation today. But Ed is a distinguished university professor and director of the George Mason University Center for Climate Change Communication, which serves as the host institution for the Medical Society Consortium on Climate and Health. Stay tuned, more about that from our presenters. Ed considers himself, and I quote, a public health professional first, foremost, and always. So thanks, Ed. And Ed will be driving the slides today. He's brought up as I'm introducing his co-presenters, which are Ronda Seifert. Ronda has served as a maternal child health nurse for state and county public health agencies. She has been a climate and health advocate since 2015. Importantly, Ronda is the co-chair of the Arizona Health Professionals for Climate Action, which, as you'll learn, is a new state affiliate of the Medical Society Consortium on Climate and Health that I just referenced that George Mason University is the host institution for. And our third presenter is Dr. Brian Drummond. Brian's a clinical associate professor of emergency medicine at the University of Arizona, as well as being co-chair of the Arizona Health Professionals for Climate Action. He is also a Navy combat veteran who discovered his passion for preserving our planet on the island of Guam. So we have a great panel for a super important topic, one that's been overdue for us to have a conversation on, a presentation on in these rounds. We're really thankful to all of you for joining today. As always, if you have questions or comments, please feel free to enter them during the course of the conversation in the Q&A function. We'll get to all questions either at appropriate intervals during today's presentation or at the conclusion when we have Q&A. And by the end of this week, we will have a recording of the session posted on the website that Jennifer has entered. So I'm going to pass the presenting dais virtually over to Dr. Drummond. Brian, please take it away, and thanks again for joining us today.
Thanks, Mark. Welcome, everyone. I'm glad we're able to talk to you today. So Rhonda, Ed, and I are hopefully going to just open this conversation of the daunting task of dealing with climate change and how it relates to human health. I think a lot of us can say climate change, oh, what do I need to do? What should I do? It's upsetting, but we want to try to make it an approachable topic for you and realize that you as healthcare professionals and those who are dealing with family and friends here in Arizona can make an impact. You can educate yourself and get involved with this. So here's our objectives today, kind of covering that. But at any time, feel free to put something in the chat. We're happy to address it near the end. Next slide. So before we even get into climate change, let's just talk about fossil fuels. So fossil fuels, whether it's coal or natural gas or oil, we burn those for kind of forming, four big contributions of climate change. And you would say, what are those? Those would be transportation, energy production, the agricultural industry, so making of fertilizer, and then industry, so making things like cement, making steel. Those are high fossil fuel consuming areas that we use in our society. The burning of fossil fuels, besides just carbon dioxide and methane, has some other significant byproducts, things like benzene, toluene, sulfuric acid, mercury, and then some other ones you may not be as familiar with, things like particulate matter. So you may hear something like P2.5 or P10 or PM10. And that's those numbers are referring to microns, so 2.5 microns. And if you compare that to like a human hair is 50 microns. So 2.5 microns, these are really small particulates. And so they're getting deeper into the lungs and causing more effects than some of the bigger particulates like, oh, there's a piece of ash in the air. So fossil fuels are producing these kind of chemicals. Another chemical that you may be familiar with, but in a different area, would be like ozone. So ozone, way high up, we think, oh, great, that's going to protect us from UV light. But ground level ozone has an effect on patients' health, and it also increases the heat area lower. So those are some effects that you can see from fossil fuels. And you're like, okay, well, these are all chemicals that are coming out from fossil fuels, but does it really harm people? Well, the mortality from the burning of fossil fuels globally in 2018 was 8.7 million people. That's a significant number. Now, besides just all those people that are dying from the burning of fossil fuels, if we look at what, are things affecting children, pregnant women, all the way to lower older? Absolutely. So in pregnancy, you may see effects like low birth weight, stillbirth, preterm birth, because children and pregnant women are more affected by these because they're in a younger developing state. Kids, as they're developing, may see things like autism or lower IQs or ADHD that causes neurocognitive effects from the burning of fossil fuels. Now, we think probably burning of fossil fuels, we see something burning, oh, it's got to be a respiratory component. Well, you're right. Asthma, COPD, emphysema, increased lower respiratory infections like pneumonia are all secondary to burning of fossil fuels. And that goes on throughout someone's lifetime. And the cumulative effect of these lead to increased stroke and heart attack risks. They also cause increased risks of breast cancer and lung cancer in patients. And then long-term, we see more neurodegenerative components, dementia, Alzheimer's, Parkinson's. So these are all affecting our patients just from fossil fuels, let alone climate change. Next slide. So if we were to compare something like tobacco, which is the healthcare community, we would say tobacco, we've recognized as something that's harmful to patients. It's harmful to our friends and family members. We've looked at this and said, you know what? We are so concerned about the effects of tobacco. We should advocate for our patients to stop smoking, for them to stop using these products. And we're putting out other products to get them off tobacco because we think it's so bad. Tobacco in 2019 killed 7.7 million people. Fossil fuel burning, 8.7. The logical step here would be, if we are advocating for the cessation of tobacco use and alternatives for our patients for less mortality than if we do from fossil fuels, logically, we should be advocating for the cessation of fossil fuels because it's a bigger health risk for our patients than tobacco. Next slide. So yeah, fossil fuels may determine some aspects of health, but there's other social determinants of health that we look at in models, right? Where you're born, the community that you grow up in, access to education, economic status. Next slide. But these may not be the determining things that we're seeing in the future. Ecologically and environmental factors may fundamentally shift those social determinants of health or drive them. Next slide. So as we're looking at this, we have to see that climate change itself is disrupting the normal social determinants of health that we see and may be the leading factor determining our patients' health. Next slide. So how does this affect us in Arizona? So this graphic kind of shows regionally across the United States what some of the 8 major areas of health harms are affecting certain regions. So for us here in Arizona, wildfires, extreme heat, extreme events such as drought or flash floods from monsoons, we say, oh yeah, well, we have that going on. We also have poor air quality, we have food-related infections, and something that's not often talked about is mental health and well-being issues for our patients. Next slide. So to address some of these issues, of these 8 kind of health harming pathways of climate change, we've hit on air pollution and where that's coming from. We talk and know a little bit about extreme heat and weather here. Vector-borne illnesses, when we think about that, you're thinking of mosquitoes and tick-borne illnesses. And why is this increasing? Well, people are moving to areas where those animals are and encroaching on those spaces, but also with climate change, you're seeing this effect where those animals are moving to areas where they normally didn't live. They're having longer breeding cycles and leading to more disease, whether it's Lyme disease or encephalitis or other causes of vector-borne illness. Food and waterborne illness, hunger, malnutrition, whether that's secondary to a drought in food-producing areas or a forest fire that's moving people out of their home and leading to economic strife. All of those are affecting our patients as well. And I think mental health we underestimate, but it's affected. Just if you look at what we've experienced through the pandemic and everyone's underlying stress, as well as the number of teenagers that are having issues, whether it's angst amongst, pandemic component, social isolation, or just the uneasiness of climate change in their life, this is very significant and we have to work on it. In terms of who is really being affected by this, just because everyone's exposed to a wildfire doesn't mean everyone gets sick. But climate change is really a disease of the extremes, those that don't have resilience and can't support themselves in times of stress. So who is this going to be? This is going to be the babies, the children, the elderly, those with chronic disease, dialysis, maybe they already have emphysema, elderly patients, patients in low income, patients in community of color, and then those that are exposed. So we think about, well, I work outdoors every day, for that's my economic stability. Well, air pollution's out there every time. I'm exposed to the extreme heat. I'm exposed to the weather. I'm exposed to all these vectors. Those people can't modify and say, well, I'm just going to go inside today because that's their economic livelihood. Next slide. So in terms of takeaways, from what we want to take away with climate change and how it's affecting our health, climate change is affecting the health of all Americans. And this may change based on someone's exposure or resilience component, and that'll vary across the population and communities, but every American is affected by this. Now, are there ways that we can adapt and reduce our risk and improve our health? Absolutely. And so those are aspects we want to work with our patients to be able to find ways that they can adapt and improve their health. One of the major adaptation things that we can work on is reducing our use of greenhouse gases, because those emissions are significantly affecting the health of our patients. And if we can reduce them, we're also going to lead to economic benefits, not just for our patients and us here in Arizona, but globally, and it'll make a difference for our planet. So I'm going to turn at this point over to Ed to continue with our discussion.
Yeah, thanks, Brian. And let me make one more point about this slide that's in front of us right now, which is that these are the 4 takeaway messages, key messages from the human health chapter of the 4th National Climate Assessment, which was published in 2018. The National Climate Assessment is a congressionally mandated activity supposed to happen every 4 years, and it's administered through a federal agency that you've never heard of, and so I won't bother telling you their name because you won't remember it. But it involves all 13 different federal agencies that do research on climate change. So these 13 federal agencies, they come together every 4 years, and they do a contemporary assessment of how is climate change affecting us now, including how is it affecting our health now, chapter 14, and what can we do about it? And so this really is like the definitive statement about how climate change is affecting people's health and well-being, and the health and well-being of our communities and the ecosystems on which all of our lives depend. So I highly encourage all of you who want to do any more learning on this topic to take a look at the National Climate Assessment. It's entirely online. You can find it in a quick Google search. So my job in this trio of speakers is to talk not so much about what is climate change, how's it harming our health, and whose health is being harmed, because Brian already did a beautiful job of that. My job is to cover, well, what do the American people know about this? Okay, this is, as a public health professional, and as Mark Carroll said, public health professional first, foremost, and always. I've been working on this relentlessly for the past 15 years. But what I know as a public health professional, and what Brian and Rhonda know as health professionals in Arizona, it's kind of secondary to what the public understands. If the public doesn't understand the human health relevance of this issue, we still have some important work to do. So that's my remit. I'm happy to say that unlike many people think that America is a nation divided on the issue of climate change, that half of us accept the realities of human-caused climate change and half of us think it's a big conspiracy. Really isn't so. Part of my job is that I do public opinion polling. We conduct something called the Climate Change in the American Mind poll. We've done it every 6 months since 2008. And all the way back to 2008, and especially now, it isn't true that America is a nation divided on the issue of climate change. Almost all Americans, 8 out of 10 Americans, accept the fact that climate change is a reality. However, historically, all the way back to 2008, and still the case today, we tend to see it as a distant threat. So it isn't the case that people reject it, but it is the case that they don't necessarily understand the ways in which it is relevant to them, because they see it as a distant threat both in time. They see it absolutely as a problem for future generations. They see it as a problem in space, in parts of the globe, Bangladesh, sub-Saharan Africa, places that people often can't find on a globe, but people accept that it's a problem there already. But most Americans, most Arizonans, in fact, don't necessarily see it as a problem in their community already. But most fundamentally, the way we see it as a distant threat is distant in species. So people accept the fact that climate change is a threat to plants, penguins, and polar bears, but most don't really get the fact that it's a threat to people too, to us, to our people, to our loved ones. And that's I would say that's a problem, because when we understand the personal relevance of a problem, we're much more likely to get engaged personally to deal with it. We're much more likely to support societal responses to the issue. For those of you who are familiar with sort of the psychology or the neuroscience literature, we often talk about mental frames, how people organize the information that they have available to them in their own minds. The dominant mental frame that most Americans are bringing to the issue of climate change is one of the polar bear, or more broadly speaking, they see it as an environmental problem. And that's all well and good. It's certainly true. Climate change is an environmental problem. But when it is seen as primarily an environmental problem, it tends not to be engaging for many Americans. About 1 out of 3 Americans see themselves as an environmentalist. About 1 out of 3 Americans have strong environmental values, but they don't see themselves as an environmentalist. And about 1 out of 3 Americans really don't have strong environmental values. So when the way we see the issue of climate change is through the frame of the polar bear or through the frame of it as an environmental issue, it tends not to be engaging. Another way that many Americans see the issue of climate change is they see it as a political issue. Back in the day, they tended to think of Al Gore first as the lead politician who was against climate change, which either signaled to some Americans they too should be against climate change, and it signaled to other Americans that they should be against climate change because they didn't like Al Gore or weren't a member of Al Gore's party. So when people see climate change as a political issue, it's inherently off-putting, and unfortunately in America, it's inherently divisive, polarizing. But our research has shown that of all the ways in which we can talk about climate change that are based in truth, that are based in the kind of facts and figures that you will find in the National Climate Assessment, the one way to frame the issue of climate change that is uniquely engaging, uniquely likely to pull people in, reveal the personal relevance of the issue to them, and perhaps of greater importance, uniquely capable of depolarizing the issue. In other words, no longer pushing liberals and conservatives away from each other, but actually bringing them together so that they might engage in a thoughtful conversation about the nature of our problems and the nature of our opportunities to deal with that problem. And that frame is the human health frame. When we talk about climate change as a human health issue, it is engaging, it is depolarizing, and it is a very, very effective way to start a better narrative, a better conversation out there in American communities about this issue that really is defining all of our communities, whether we like it or not. In our polls, we I'll go back to this this picture. Before we ever mention the words global warming or climate change in our polls, we ask people, what's the first thing that comes to mind when you hear the words global warming? And we then record their answers verbatim, and then we code those later. We determine what they say, we put them into categories, and we take a look at it. I would guess I've probably surveyed between 30 and 40,000 people, but since 2008 now, until now on this issue, I don't believe we've had a single person out of those 30,000 plus people ever answer that question. What's the first thing that comes to mind when you hear the term global warming? Nobody has ever given us an answer that related directly to human health. Mostly people say things like polar bears, penguins, icebergs, sometimes they talk about consequences that can harm health, like heat waves, but nobody ever mentions people. Nobody ever mentions their people or people who do have their health harmed by climate change. When we ask them a different set of questions, climate change is a whole bunch of different kind of issues in reality, and the National Climate Assessment is organized into chapters, one chapter for each type of issue. For example, an agricultural issue, an ecological, a forestry issue. But we ask people, in your opinion, do you think global warming is each of the following types of issues? An environmental issue, a scientific issue, an agricultural issue, etc. As you can see just from the people's responses to this question, as I've already said, most people see it as an environmental issue. But now a growing number are beginning to see it as a human health issue, 6 out of 10 currently. But the revealing part comes next. When we ask them, people who tell us it's a human health issue, we ask them, in what ways does climate change harm people's health? Most people can't give an answer to that question. And we ask another follow-up question. Well, are there any groups of Americans whose health is most likely to be harmed by our changing climate? And most people can't answer that question either. So the kind of information that Brian presented to us a moment ago about what's happening to our climate, how is that harming our health, and whose health is most likely to be harmed, that's really useful information that most Americans simply don't currently know. My expertise in the field of public health is I'm a communication scientist by training. So I study how we use communication campaigns to help people understand the health threats that are relevant to them and their loved ones and what they can do about it. And in the many years that I've been doing this professionally, I've learned only one thing with absolute certainty, and that is that effective public communication campaigns always have are sort of built on the same formula. And that formula is simple, clear messages repeated often by a variety of trusted and caring voices or sources. This is not only the formula for effective public health communication campaigns, it's also really the formula for public campaigns of any sort, including political campaigns. You look at the nation, your community's most effective politicians, you look at our nation's most effective politicians, and they have an intuitive, deep understanding of this is how you get through to people in your community, in your audience. You need simple, clear messages. You got to repeat those messages over and over and over again. And even if you are a trusted source, you still want to bring in additional trusted sources to amplify your simple, clear messages. And that brings me to us, right? We all of us in this conversation today, we are all unified as a result of being health professionals. And I am happy to report to you that in 2022, no matter what it feels like in your practice or in your work as a health professional, I know it feels a little crazy now that COVID pandemic has brought out the worst in many of us in terms of not trusting the science, not trusting the evidence about the pandemic. But even that notwithstanding, health professionals in every country in the world and in every community in America, health professionals are in a category by themselves in terms of being most trusted. It has always been the case. There's been a little tiny dip downward in public trust in health professionals during the course of the pandemic, but we are still the most trusted. So of that formula for effective public communication campaigns, the trusted and caring voices, well, my friends, that's us. We are those trusted voices, and we are caring voices, which is why we sought out to become a health professional in the first place, because we care. So right away, every one of us in this conversation, we've all got the most important attribute going for us in terms of helping the public understand the realities of climate change as a human health issue. In our research over the past 15 years now, almost, we found that there are really only 5 key truths about climate change or about global warming that really make a difference in terms of how people, in terms of differentiating the people who understand the risks we face and who are getting involved in one or a variety of different ways to do something about it. And those 5 key truths really do come down to 5 simple, clear messages, which is nice from my perspective as a public health communication expert. The 5 key truths are: it's real, right? Global warming is a reality. It's happening. It's us. Human activity is the main cause. As Brian already said, burning fossil fuels is not the only human activity that's causing global climate change, but it's the primary one. The third truth is that experts agree. More than 99% of the world's climate experts are convinced, based on evidence, based on data, that human activity is warming the planet. So this isn't their opinion. This is the conclusion of their science that they've been conducting for 50 years now. Fourthly, there's that climate change is bad. It's harmful. It's not just harmful to plants, penguins, and polar bears, but it's harmful to people, and it's particularly harmful to our health. And as Brian mentioned, there are certain communities, certain groups of people whose health is being hurt first and worst as a result of the local climate change in our communities. And then the 5th and final key truth is the fact that there's hope. There are actions we can take that will make a profound difference. Both actions by which we can protect ourselves and our loved ones, those are often called adaptation actions, as well as actions that we can take to limit and prevent further warming, which are called mitigation actions. And the beauty of thinking and talking about climate change as a human health issue is that many of those actions will take years or decades to have climate benefits, to to limit the warming of our planet, but most of those actions will have immediate benefits in our community as soon as we take them. So the sooner, and Rhonda's going to talk a lot more about this, but I'll just summarize by saying the sooner we take the actions to decarbonize our community, whether that's Tucson or Phoenix or Flagstaff or what have you, the sooner those communities take actions to decarbonize, the health and well-being of people in those communities begins to improve almost immediately. So the climate and health team at CDC has long known the value of simple, clear messages. For many years now, they've been featuring these 3 key messages in their work. The fact that climate change is harming our health now in communities across the nation, that some of us are being hurt first and worst, which is their second message, that any of us can have our health harmed, but some of us are more likely than others to be harmed. And then finally, the message that there's hope. There are actions we can take, many things we can do right now to limit climate change and improve our health. And Rhonda will go much deeper into those in just one moment. But I just wanted to share one other thing that we've learned from our polling research and from our message testing research. And that is that the most effective climate and health messages have 3 components, okay? The first component is explaining to people how climate change harms our health, as Brian has already done for us today. The second component is to talk about solutions. Remember, that's the 5th key truth, that there's hope. There are actions we can take. So you as a trusted health professional talking about climate change, you not only want to talk about the health harms, but you want to talk about the solutions, and particularly the policy level solutions, not individual behavior changes. It's okay to talk about individual behavior changes as long as you're also talking about community level changes, policy solutions, because people have a deep intuitive sense that this is a large scale problem, right? We call it global climate change. And if you're recommending that people, change their light bulbs or plant a shade tree outside their front door to provide a shade on their home, those are perfectly good things to do, but people recognize there's a scale problem there. So we've learned that when you talk to people about individual behavior change, it tends to actually reduce their support for appropriate policies, reduces their level of engagement in the issue. But when you talk about policy solutions, it increases their engagement and it builds their support for policy solutions. Then the third and the final component of an effective climate and health message is to invoke a positive social norm, a helpful social norm. Most Americans who are concerned about climate change, and that would be 7 out of 10 Americans, give or take, most of them feel they're in a small minority, that they and very few other people are worried about this issue. And they and very few other people are taking action on this issue, which isn't true, but people don't know that. So it's helpful to invoke a social norm and make the case that most Americans agree that we want healthy communities and a healthy climate. And many of us are taking action already to do something about it. Join us, join me. So those are the 3 components of an effective climate and health advocacy message. Of the 3, we know that in fact, the solutions message, the policy solutions component, is the most activating of those 3. So they're all important, but I particularly want you to place an emphasis on what we can do together with better public policy to address this problem. There's one other element of an effective climate and health message that we know of. We haven't yet published it. We're working on the manuscript right now, but we felt that given how important it is for us to take actions that will help stabilize our climate and improve our health, why haven't we done it yet? And the reason we haven't done it yet in large measure, although the Inflation Reduction Act of 2022 took a big step forward recently, but we're still pretty far behind as a nation, and in most US states and most US communities, we're not really out there getting out there as quickly as we can. The question occurs to many people as to why. So we have learned it's helpful to proactively answer that question. Why are we not making progress fast enough? And the answer is because we have opponents. There are vested political actors out there who are working really hard to stop us from implementing effective public policy that will help stabilize our climate and protect our health. And we've learned that it helps to call out fossil fuel CEOs and their lobbyists and the politicians who are under their sway. We don't have to call them out by name, but call them out by category. And we know, we've tested it. We know that when you point out that these are our opponents, these are the people who are stopping us from doing the right thing, that really does solidify people's commitment to stepping up and taking action. So with that, I turn the mic over to my friend and colleague, Ronda Seifert.
Thank you, Ed. That was fantastic. So Brian talked about how our changing climate is harming our health, and then Ed shared that the way we talk about it matters. And now I'm going to talk about what needs to happen and how health professionals in particular can help. Next slide. So there's 5 pathways in which we can improve our climate and health. And the number one, as Ed talked about, is reducing our fossil fuels as rapidly as possible. We're warming our planet with these heat trapping gases, and we have to rapidly decrease. And instead, we're actually still increasing, and that means more warming. But the good news is that renewables like solar and wind and plus storage are actually the cheapest option in most places. So we can do something good for the climate, good for our health by reducing those fossil fuel pollution, and at the same time, there's a cost saving. And then on the other side of that equation is energy efficiency. And we can improve that with things like weatherization, insulation, sealing windows and doors, installing high efficiency cooling and heating and other appliances like stoves. Putting in those LED lights, they do help. Just overall reducing our energy waste. And that also means reducing, reusing, and recycling. And lots of these have incentives in the Inflation Reduction Act that was just passed. Our second huge area is our food systems, what we eat, how it's grown, how far we move it before we eat it, how much of it we waste. Our food systems can either contribute to the problem or help with solving the problem. And again, our climate health is also healthier for us. In fact, most, as Ed pointed out, most climate solutions are also health interventions. So we can eat more plant-based diets. We can eat foods that are regeneratively grown in ways that support our soil health and biodiversity and reduce those bad chemicals in our foods. And let's eat food that hasn't traveled across half the planet to reach our plates, right? The next area is transportation sector. We need to make mass transit the easiest, cheapest option for moving things, and when we have to, we want to use electric vehicles and trucks. And also encouraging less resource-intensive options like e-bikes and making our communities more bikeable and walkable. And again, lots of health benefits from that reduced pollution and active transportation. In terms of our buildings and homes, we need to be building smart. So if it's a new build, it should be all electric and high efficiency. We need to be building community solar, especially in our communities with high energy burden. We need to think about daytime charging options at workplaces to take advantage of our ability to provide solar power. And we need to keep climate challenges in mind. We know we're going to have more drought, more extreme heat, more extreme weather with flooding and wildfires. So how do we mitigate against that? How do we reduce that? How do we minimize water waste? We need to build in ways that reduce heat island effects, not add to it. Those higher temperatures also mean heavier downpours, and currently a lot of our built environment kind of encourages water to run off into sewers where it causes flooding and often gets polluted. So let's utilize nature with things like green roofs and rain gardens and green corridors and landscaping options that are both drought tolerant, but also support native insects and pollinators and reduce those heat island impacts, and then help our water to seep into the ground where it replenishes our water aquifers. And then in terms of our community environment, We know which communities have the highest air pollution, which neighborhoods are much hotter than others, where heat deaths are happening. It's in our communities that have historically been redlined, where we have underinvested for a long time. It's our low income and communities of color and some of our elderly communities. And we need to advocate for investment in investing our public dollars wisely. And we can do that by targeting our most at-risk neighborhoods for those projects, ensuring change where it is most needed. And we as health providers can help policymakers understand what some of the barriers are that might prevent a low or middle income individual or family from benefiting from some of those incentives in the Inflation Reduction Act. And if we do a good job, then we're going to improve our community resilience, we'll improve health outcomes, and reduce health inequities, and reduce healthcare costs. So, and most importantly, reduce it where it's needed most. Next slide. So as health professionals, we are trusted voices, and so we can have a huge impact. First, by helping the public understand, like Ed was saying that Brian had done, helping to understand how our climate change is harming our health. And that helps to build political support for climate and health solutions, and also helps to get climate smart candidates elected. And then we can in turn influence those public policy makers. You know, last fall, there was an Arizona senator that was talking fairly negatively about climate solutions. And in less than a week, almost 100 of you Arizona health professionals, and a lot of physicians, signed a letter supporting climate solutions and expressing concern about the growing public health impacts here in Arizona. And then about 7 of us delivered that, along with some of our personal stories of how we're seeing climate impacting health. And immediately, that senator stopped talking negatively about climate policy and eventually supported the largest climate policy ever passed in the US. And I will say it wasn't just us. There were climate advocacy groups, there were city governments that advocated, business leaders, lots of individuals who also helped. But I believe it was the powerful voice of health professionals who really made a difference. So thank you. We also need to engage our corporate policymakers. One great thing is that corporations don't need to wait for political agreement. They can respond to customer demand. And as Ed shared, the majority of people, regardless of political affiliation, support climate solutions. And those corporations can drive others to reduce emissions. So just one example, they can demand clean energy from utility companies. And they can also do private and public partnerships, and that can help more rapidly transition us to clean energy. And we as health professionals can help those corporate leaders understand the importance and the urgency of climate solutions for our health. A fourth really important area is engaging our own health and educational institutions. The US healthcare system is responsible for 5 to 9% of US emissions, and that's a lot. And what comes to my mind is first, do no harm. We have an ethical obligation to stop contributing to public harm. And the great thing is there's some really great resources, Practice Green Health, My Green Doctor, that are specific to helping us decarbonize our healthcare. And the other really great thing is these changes often result in cost savings. So it's a win. And then finally, leading by example. First off, I can tell you from personal experience, it feels good to do something when we can. But it can also, we can become that person that is answering questions about how and why you made that change. So maybe we installed solar. Maybe we're driving an electric vehicle, or maybe we changed to a more climate-friendly anesthetic gas. By being that early adopter, others can ask questions and they're likely to follow. Next slide. I wanted to include this Venn diagram from Ayanna Elizabeth Johnson, and she has a short TED Talk you might be interested in. And it's all about finding you individually, finding your place in climate challenge. But I think the biggest message is that don't think you must quit your job to help. And in fact, your strengths, your unique skills, your relationships is where you are right now. That's where you can really make a difference. So we need you to be empowered within your current role as a health professional. And that can be as simple as just asking the right questions. It kind of gets other people to think about climate and health. Right. Sorry, next slide. So as health professionals, we can be really powerful initiators of change. And we're uniquely positioned to influence both policymakers and the public. And the Medical Society Consortium is all about helping us to fill our gaps in knowledge and to be more effective. And that could be, maybe we need to learn a little more about the climate science or how it's impacting our health, how to talk about it, how to talk with policymakers, you know, how do we decarbonize? But I think most importantly, we can help you find your allies. Next slide. I wanted to include this slide because I think, as Ed pointed out already, there's a huge misperception that it's still a minority of people who are worried about climate change. And the reality is the majority of people, regardless of party affiliation, are concerned about climate change, and a super majority support climate action. So you have a lot of support for this work, lots of allies, and it's part of protecting public health. Next slide. So this is our QR code for the Arizona Health Professionals for Climate Action interest form. I just want to encourage you to point your phone camera at this QR code, click the link, and fill out our interest form. And there's lots of options to be involved. It can be as simple as you just want to get notifications of upcoming climate and health opportunities. Maybe you are interested in some form of advocacy, and maybe you'll participate in one of the work groups. You can choose your level of involvement, but I encourage you to join us and find your climate and health allies and become a powerful advocate for climate action. The reality is we need all hands on deck. So thank you. I want to say thank you to Dr. Mark Carroll, to the NARBA Institute, to Blue Cross Blue Shield and Arizona Health Choice for wanting to talk about this critical public health topic. It's so important. And thanks to Dr. Drummond for being an awesome co-chair. And Dr. Maibach, you've been doing years of outstanding climate advocacy work, and I really appreciate what you've done. So, and I think now we're going to open it up for questions, so I'll turn it back over to Dr. Carroll.
Well, thank you, Rhonda, Brian, and Ed for a fantastic summary and move through a very complex, large, global topic and bringing it down to understandable terms and actionable terms. I pointed my camera, took me to the site. My thumbs aren't fast enough to sign up and talk at the same time, so I'll have to do that at the end. But we will certainly share that information. Let's go to a couple of questions. I actually invite Ed and Brian, if you can take a peek at the questions that have come in the Q&A and possibly respond to them. Rhonda, though, I wanted to respond to something that you said, which is it feels good to do something. And it does, which is what brings so many people into the health professions in general, whether those be public health, direct care in any way, shape, or form for people. When the state, in the northern part of the state, for example, has had such challenges with fires recently, especially this summer, and floods from that, any thoughts or advice on how to take things that seem just so big, and you've already commented a little bit about this, just so big, even if we wanted to do something, down to levels of action? Any additional thoughts or that messages you'd like to reiterate? Is this is more than planting that shade tree or buying that electric car and then figuring out where you can charge it in rural Arizona? It's more than that. There are daily things that people can do. Is that right?
Yeah, and I think, the answer to what can I do is as varied as the answer to, what kind of nurse are you, or what kind of physician, what population we work with, whether we're doing small local actions or all the way to global? The answer to that is really varies. And so it kind of depends. One of the things we do have on our Arizona Health Professionals for Climate Action website is we've got some of those resources that can help, you know, if you're in a hospital setting, Practice Green Health can help you with those. What are some of the ways that you can do it? As an individual, there are different answers to that. And I know Brian loves to talk about this too, so I'd encourage him to come in here. But there are smart, and I just recently read a great article from Janice Hawkins in Nurse Leader, where she talks about reducing carbon in the hospital settings and while saving money, and it's A to Z. So it's like 26 ideas. So there's lots of ideas out there that people can do.
Yeah, in terms of the big ticket ones that Rhonda's kind of referring to, I like to tell people 5 things. One would be fly less. 2 would be renewable energy. And here in Arizona, probably solar would be the best. Drive less, or drive not at all, or drive electric. So changing your transportation method. A plant-based diet, or going to, oh, I don't want to become a full vegan or vegetarian. Will decrease your meat consumption. See it more as a condiment or a supplement, not as a main part of your feast. And then the last point would be just family planning. You know, in terms of decreasing number of children is probably the biggest thing. Now, not a lot of people want to hear that, but having a family when you think it is best for you and advocating that for your patients and empowering them leads to better infant mortality rates, maternal mortality rates, education, economic success for that family. So empowering women for their family planning, I think, is something that we can encourage everyone to do. Those are the 5 big things. There's tons of little things. I agree with Rhonda, but those are probably your 5 biggest, and not everyone can do that. But if you can, those would be the best things to work on.
Yeah, thank you. Ed, please go ahead.
Yeah, I want to add a health facilities perspective answer to that. A friend of mine, a man named Jeff Thompson, he is now the emeritus CEO of Gunderson Healthcare in southwestern Wisconsin. I can't remember how many hospitals he has in his hospital system, but a dozen or more. And Jeff really wanted to, this was probably goes back 10 years now, but 10 years ago when he was the CEO, he wanted to decarbonize their healthcare facilities because he understood that, you know, healthcare that produces pollution is not healthcare that is truly in, you know, the best possible healthcare. So he set out to decarbonize all of their operations. And his board of directors, by his accounting, a very conservative group of community members, mostly businessmen, were willing to give him, I think, $1.2 million to invest in the initiative at first. And he came back to them in under 18 months, having invested that $1.2 million in decarbonization efforts, and he showed them in an internal rate of return, meaning essentially a level of profit on that investment of 16%. And his board was so blown away by an internal rate of return of 16%, he was not only doing the right thing and running more and more of their operations on clean energy, he was saving the hospital system boatloads of money. And so his board invested more. And over the span of about 5 years, they reduced their carbon pollution, their emission of heat trapping pollution, by something like 95%. And throughout, as Rhonda said, it was a money-saving effort throughout, because the harder they worked at it, the more creative their solutions. For example, they partner with a local brewery and they take the mash from making beer and they put that into these biodigesters that create electricity. And so it's not only a win for the hospital system and for the people in the community, it's also a win for local businesses who have now partnered with the healthcare system in their decarbonization efforts. So there's incredible stories out there already. They are unfortunately the exception rather than the rule, but they can become the rule for every community in America. And in order to really become the nation that we need to become with regard to living prospering in the era of decarbonization, it's going to be a win-win-win, but the sooner we do it, the sooner we will start realizing all of those benefits.
Courageous leaders promoting conversations. I was struck, Ed, by something you said earlier about trusting and caring people, elevating health and the impacts on health in conversations with patients, families, colleagues, leaders in our institutions and organizations, being good listeners, but also being good communicators and understanding what key messages are. That definitely jumped out at me, and I think that's one of my big take homes for today. We do have a couple of comments, if I may just go through them quickly. I'll read the first. The economists point out that we can use the market to assist us in making better choices, cleaner energy, et cetera. And yet we don't hear policy related to pricing pollution. Any thoughts about why not?
Yeah, you know, as Gretchen points out, economists are totally unanimous. They're in full consensus that making polluters pay is the smart way to deal with the problem. Unfortunately, it doesn't get a lot of political traction because because politicians fear that their voters won't put up with it. The Inflation Reduction Act of 2022 is essentially a set of solutions that are less optimal than putting a price on pollution, but they're more politically viable. When you compare to what's in that bill to what our public opinion polls show is popular with the public, it's almost as if some astute politicians were looking at the public opinion polls and giving the American people what they wanted. And what did they want? They want help in making these transitions in their own lives, whether that's their home or their small business or the school in their community. And so those are the kinds of policies that we as a nation are now going to be supporting through the IRA. And they're great. I'm super excited about them, but it would have been even better if we had put a price on pollution.
Thanks. And Patricia also brought up a key point in the Q&A. Thanks, Patricia, related to the roles of medical associations. I think that gets back to engagement, and the engagement perhaps from all of us, if the panelists would agree, in our respective professional associations and societies. We may find that there is momentum there, that a couple of extra pushes can be helpful for. But there is engagement that we are asked to consider today with the QR code that was brought up. So do you want to bring that QR code up right before we leave again, Ed, if you can, to that last slide, or at least a link for where people can sign up. You just point your phone camera at this if you're interested, at least bring you to something to learn more information. I'd encourage folks to do this. If you want to learn more, this doesn't mean you have to go and advocate one way or another for a topic in front of any policymaker. But at least an opportunity for us to engage, learn more about topics so that perhaps all of us together can become better communicators. And Rhonda, thank you for putting in some links into the chat. Well, I know we've come to the end of our time. If we could come off the share for the close. I want to thank our panelists for a great presentation, more importantly, for your commitment and dedication to a vitally important effort. Ed Maibach, you've been friend and colleague for decades. I admire the commitment that you've made to an important topic like this. And to do that over decades, the support that you've had from George Mason University has been outstanding. But it's individuals like you, it's individuals like Brian, Ronda, and those joining today that always will make the difference and be the difference. My other take-home message for today is that there doesn't have to be, and there's not as much acrimony over this issue. We are more united in our understanding of the issue. How we talk about it, though, and how we relate it to our health and the health of those we care for, I think that's one of our challenges moving forward. So with that, we'll close today's edition of Arizona Community Grand Rounds. Thanks again to our panelists for the work they're doing, a great presentation. And we wish everyone well and look forward to seeing you in our next Arizona Community Grand Rounds in November. Take care and be well, and always be kind. Bye now.